Hello friends, let us now learn some important points about the lateral chest x-ray. In the lateral chest x-ray, the lung part is done. Okay, all the lungs issues were done. Now let us learn about the lateral x-ray, normal lateral x-ray and its effect with heart. So in the lateral chest x-ray, if you see heart, obviously heart is in the mediastinum. Number one, it is in the mediastinum, just like always, and the anterior part of the heart. Okay, we are dealing with lateral chest X-ray. Obviously, in the lateral chest X-ray, anteriorly, the heart is bordered by the right ventricle. Number one, it is bordered by the right ventricle, and posteriorly, we have two chances. One posterior is this one. So one behind the hila. This is hila. So one behind the hila. So posteriorly behind the hila, it is bordered by, is surrounded by left atrium. Okay. Posteriorly below the hila. Posteriorly, if you see below the hila, it is now bordered by left ventricle. Posteriorly below the hila, bordered by left ventricle. So this is left ventricle. This is left atrium. So this is right ventricle, left atrium, left ventricle. So these are the boundaries of the heart. And one important thing which you have to see is in lateral chest X-ray, the heart should be homogeneous. There should be no abrupt change in density of the heart. There should not be no abrupt change in density across the shadow of the heart. So this is one important thing. If there is any change, but if you see if there is any change in density, if there is any change in density, then always and always you should suspect superimposed pulmonary pathology. We should suspect superimposed pulmonary pathology of the lungs, that is pulmonary pathology. Now, you see here, we can see the inferior vena cava. Right? How? This is the inferior vena cava. Here in the lateral X-ray, this is inferior vena cava. This is inferior vena cava. In lateral X-rays, inferior vena cava is seen as a short. Obviously, it is short. It is well defined. You can easily see that shadow. It is vertical. Okay, it is a short, well defined vertical shadow, and this shadow will meet the posterior and inferior aspect of the heart. This is posterior, this is down the heart. So it meets the posterior and inferior aspect of the heart. So this is IVC. One important thing is you can see the posterior wall of IVC clearly visible. Why? The posterior wall of IVC, wall of inferior vena cava, is visible because this posterior wall of inferior vena cava is mainly outlined by air in adjacent lung. So because of the adjacent right lung, in the adjacent right lung, because it is outlined by air, you can visualize the posterior wall of the inferior vena cava. Then if you see bones and soft tissues. In bones and soft tissues, in the lateral chest X-ray, you will see that here the bones will overlap each other and it will result in a shadow. So one important thing is that these lower vertebral bodies look blacker when compared to the upper vertebral bodies, because in the upper vertebral bodies there is soft tissue superimposition is seen, whereas in lower bodies there is less, lower vertebral bodies there is less soft tissue superimposition. And one more thing is because of the rays, the absorption of rays inferiorly is less when compared to the superiorly. So as a result, this upper part will appear more whiter when compared to the lower part, which appears more darker. Then, now see this chest X-ray. Is it normal or abnormal? Yeah, we think it is an abnormal chest X-ray, but actually it is normal X-ray, normal lateral chest X-ray. How? Because if you see here, this mass which you are seeing is nothing but the heart. Here, heart, here there are two shadows. One we have right dome of diaphragm is present. Okay, what is this? This is the right dome of diaphragm. So I'll do one thing. This is the normal picture, right? Okay. So if you see here, this is the, I'll draw with better color. So this is the right dome of diaphragm. And what is heart? Like this. So this is the heart. Okay. Both these have overlapped and it produced a fake mass, which is actually not a true mass, but it looks like a fake mass because of this overlapping of the right dome of diaphragm with the shadow of posterior margin of the heart. Now, next important thing in lateral chest X-ray is age-related aortic unfolding. If you see in this X-rays, this is frontal X-rays. Here, if you see, the aorta is seen behind. It is in mediastinum and it is behind. It is not seen, right? Number one. And this is in the younger age, aorta is not seen. As the age becomes 60, you can see this aortic unfolding has started. And here you can even see the ascending aorta and also descending aorta are also seen at the age of 80 years of age. Now, what about the lateral X-ray? In lateral X-ray, if you see, right, this is the normal chest X-ray where you can see this is the aorta. Okay, this aorta is actually situated in the mediastinum. You can see this is the mediastinum and it is situated here. This is the aorta, which you can see clearly. Okay, this is situated in the mediastinum normally and it is not actually clearly visible. But as the age increases, here you can see that the aorta is clearly visible here. Because this descending aorta is now outlined by the lungs. Because it is now outlined by the lungs, it is clearly visible, has some tubular opacity on the lateral X-ray. And this visualization of descending aorta as tubular opacity is a normal thing, not an abnormal entity. Next. If you see here, you are seeing a fake, this is a mass which you are seeing. But this is not a true mass, this is fake mass. Why? Because it occurs because of overlapping of apex of heart with epicardial fat. Whenever there, because of the overlapping of apex of heart with epicardial fat, it looks like a mass. It produces a shadow which will stimulate the mass lesion. Okay, so this is one thing which we should remember. Next, if you see, this is the normal lateral chest X-ray, and if you see the vertebral bodies, these vertebral bodies from superior part to the inferior part, they are becoming superior part, they are a little whiter and slowly they are becoming more blacker. This is because in the superior part there is soft tissue and bone overlapping which will produce whiter structures, whereas in the inferior vertebrae, thoracic vertebrae, this appears blacker because of beam. The beam which passes through the inferior, the beam of X-ray which passes through the inferior vertebral body is absorbed less when compared to superior. So the inferior vertebral bodies will appear as blacker. Next, see here, the vertebrae are whiter inferiorly. See here, if you see here, what is this? This is the white. Normally here in normal vertebrae, the in the lateral chest X-ray, the vertebrae is blacker. But here you can see that the vertebrae are whiter. Why? Because this hole is actually a lower lobe collapse. Lower lobe pneumonia. Sorry, this is lower lobe pneumonia. So these are not white vertebrae, but this is actually an opacity seen or noted in the lower lobe. That to left lower lobe, resulting in left lower lobe pneumonia. Then, this is one more picture of a patient. Here, if you see here, the vertebrae here are again whiter. So here again there is a consolidation noted, consolidation or opacity noted at the right dome of diaphragm, and thus it is called as right lower lobe pneumonia. Okay, because this both, which is right and which is left, how are you going to differentiate it? This is by the dome of diaphragm. See, this is the left dome of diaphragm. So as a result, this is left lobe opacity. Whereas if you see, this is the right dome of diaphragm, this is the left dome of diaphragm, right and left. Here, because the opacity is on the right dome of diaphragm, the left dome of diaphragm is visible clearly. Whereas here, the only one dome of diaphragm is visible, but not the other, because the opacity is in the left lower lobe pneumonia, left lower lobe. Next, this is again a patient with persistent cough and hemoptysis. Here also you will see the vertebrae here are whiter than the above vertebrae. Here whiter vertebrae. Okay. Remember, so this is an oblique fissure. And what are you seeing here? Here there is an opacity noted in, this is lower lobe. Obviously you are seeing only one diaphragm, not the two. So this is left lower lobe. Because there is an opacity in the left lower lobe, and you can see the displacement of this oblique fissure posteriorly, is actually a collapse of left lower lobe um, collapse. Okay, oblique fissure is displaced. This is actually the displaced oblique fissure. Next, this is again one more picture. Here if you see, we have hilar lymphadenopathy. These are hilar shadows which are present. These hilar shadows are enlarged. Because of the enlarged hilar shadows, you will see that there is lymphadenopathy noted in these patients. Then, if you see, one important thing which you can see in the heart is that this hole is the heart, but here you can see that there is change in density of heart shadow. Here, this part is more whiter when compared to this part. Actually, this whole part which you are seeing here, this is actually an opacity which is noted in middle lobe. And that is the reason why there is a change in density of the heart shadow. And this is called as middle lobe pneumonia. Next, if you see the next chest X-ray, here, if you see here, this is an air fluid level. What is this? This is the air, this is the fluid. So obviously, you are seeing an air fluid level here. And this air fluid level here, this is actually a hernia which is showing the air fluid level. Now, this is one more picture where you can see that this is a lateral X-ray, and here you can see a well-defined nodule noted, and this is actually a solitary pulmonary nodule which is seen over the heart. Okay, so these are important X-rays and important things about the lateral chest X-ray. Thank you.